agenda. So I'm going to hand over to Mary, who's leading the work on the development of the Health and Wellbeing Strategy for Herefordshire.
Thanks, Christine. Okay. Thank you, Christine. I also will be brief because I'd like to hand over to the impact team to do the next piece of workshop work. But so I'm just going to bring you up to speed with what's happening with Herefordshire Health and Wellbeing Strategy, which, as Ali mentioned, will be aligning and working with the ICS and other partners to actually implement and make it a real and useful kind of strategy and document. I won't go, I know Christine says that some of you have seen some of this before, so I will try and skip over some of the stuff that I think you already know. Vision, guiding priorities, prevention, universalistic approach, but more for those that need it, a partnership approach, narrowing health inequalities, which you'll all know about, developing it in close collaboration with our partners like yourselves and the NHS, because we can't do it all, can we? Very much based around wider determinants of health. So it's not just about the individual, is it? It's about the individual in society, where they live, where they work, their relationships, all those kind of factors, again, that you will know only too well. We did a workshop in September for those that weren't there, where we asked you what were the issues that the clients you work with were telling you about, and got a list there. Not surprising, of course, you know, the rurality of the county, cost of living issues, loneliness and isolation. And we are very much aware of those, and it came out in our joint strategic needs assessment last year. So that was a very useful piece of work. Thank you. And I just want to put that there to say we have taken note of that. And again, I won't spend too long on this, but that's from the JSNA last year about the key headlines. So when it came to putting together the proposed priorities that we are consulting on, we wanted to stick to this criteria because it's good, it's evidence-based and it's feasible, and we know we can do something about some of this. So outcomes that are poor or worsening, that affect significant groups of people, they require partnership working, we can respond to through partnership working, strong evidence base for potential interventions, and evidence on their impact on inequalities. So here we come to the crux of the matter, and you've had a handout on this morning, Christine says. So this is all open for discussion. We designated 4 areas, if you like. So we've got thriving communities, healthy and sustainable places, opportunities for all, and healthy people. And sitting under those sort of 3 points under each area, so 12 potential priorities altogether, we've got this list that we have come up with. And I'm going to hand over to Impact in a few moments to go through with you some of those points and just do a bit of explanation. And I guess one of the things I should say about, you know, priorities, a lot of this work we're doing already, you're doing already, the NHS is doing already, we're doing it as a partnership. Some of it we have to do, of course. If we look at sort of best start in life for children, we have to have children and families team, we have to have midwives, we have to have health visitors. Some of this work doesn't stop, even if it wasn't chosen as a priority. But I guess what we're about is, this is a longer term strategy. We're thinking 10 years. And maybe we kind of hone it down and think, well, what can we do for the first 2 years? Shall we concentrate on X for the first 2 years? And then the next 2 years after that, shall we concentrate on Y? We'll give it a bit more of a focus. So that's what we're after today, if something's not chosen as a priority, it doesn't mean that nothing gets done. I suppose that's the message that I want to just put across to you. I'm nearly done. Little roadmap where we are. We're consulting with the public at the moment. We've got an online survey, which I hope you've heard about by now. It's running till the 11th of December. And we are also running some face-to-face engagement sessions with the seldom heard groups, people that aren't online, people that don't engage very easily with us, and Impact are running those sessions. And it's proving very, very interesting as I've gone along to them. We will be feeding back to them, to yourselves, to the NHS, and there will be some possible changes made to these priorities. So really today, please give us your views. We want to hear that. I very much want to take this back and put it into the pot for consideration. So thank you for listening, and I do hope you have an interesting workshop for the next 3/4 of an hour. Thank you.
Thanks, Mary. And just a plea, really, we've got until the 11th of December. And if you could share this survey link with your customers, clients, community groups, we want to get it as far as wide as possible to get as many responses as we can. So the links on the slides and